When we get surgeries done, most of us are unconscious. But what we don't know what is happening while we're under anesthesia. And you don't know what kind of sterile techniques are in place to protect you and the surgical team. I'll be talking about what is sterility and why it's important in the operating room. Many patients may not care what happens to them while they're unconscious, since they'll just be asleep and they just leave their lives in the hands of professionals. But it's a good information to have in order to be aware for yourself and for a family member. I'm a surgical technologist student and have been properly trained on sterility and aseptic technique to maintain a sterile fields as to not cause surgical site infections to the patients. I have read multiple books on the subject and have been tested immensely. Today I will give you information on what sterility is, what is aseptic technique, and what can happen if you break sterility. First of all, let's start with what is it? Sterility is oftentimes confused with disinfectant or disinfecting. Sterility is the destruction of all microorganisms in an animate or inanimate surface. As explained in the 2018 Surgical Technologies Principles and Practice book, sterility is absolute. There is no, something is either sterile or not sterile. There is no partial sterility. So, a sterile field is the space used to keep your sterile items. It must remain so throughout the procedure. This is to prevent contamination. So contamination occurs by touching a sterile item to a non-sterile item. There is also something we call gross contamination, which is, for example, when a sterile wound is in contact with highly infectious source. So sterility is used with surgical instruments, supplies, and medical devices. And how we test for sterility is with chemical agents and biological agents. With chemical agents, there's a strip that you can place into this machine that turns black when all the criteria is met. And the same goes for the biological agent, which you can place in the machine as well, but that carries a bacteria in there. And when all the criteria is met for that one, the bacteria is killed. So that's how you know it's good to go and ready to use. And these machines are used for all medical devices that we use in surgery, the supplies, and the instruments. Now that we talked about what sterility is, let's discuss the important part of keeping the process, like how we keep it sterile. Aseptic technique is a practice that is used to prevent contaminations of microbes. They are a strict set of rules to minimize the contraction of infection to the patient, and it's also used to keep the surgical member safe as well. The guidelines for aseptic technique are important to remember because if broken, there can be some serious consequences. One, the consequences can be the surgical site infection developed in the patient. Two, you could get yourself contaminated with an infectious disease. Three, if a surgical site infection happens multiple times at a hospital and you're on that surgical team, you can get subpoenaed. So, to prevent that, there are barriers in place for keeping surgical site infections to a minimum. For example, as stated in the 2020 Operating Room Skills Fundamentals for the Surgical Technologist, that the gown and two pairs of sterile gloves provided they form a barrier that protect the patient from contamination of the surgical wound and from surgical site infections. In addition, we can touch on the subject of consequences because that happens when you break sterility. A surgical site infection is the result of when the surgical wound is contaminated with microbes such as bacteria. So, in the surgical site infection, it can be split into two parts, into two categories. One would be endogenous, which means that it calls from the patient's own tissue. That means a surgical site infection is gained from the microbes on your own skin. The second would be exogenous, which is the infection is caused by sources outside of your body. Some of the consequences if a patient gets a surgical site infection are: one, the patient could suffer and has to pay more than bargained for due to the infection. Two, the patient can sue the surgical team. Three, an investigation can occur if there are multiple cases of the surgical site infection within your surgical team. So, to conclude my speech on sterility, I have informed you all extensively about sterility and how important it is to you as the patient and to the surgical team. Also, on what we do as surgical technologists to keep a sterile field and the consequences if we fail. So, when you have surgery, just know that there are protocols in place to keep you safe because to us, patient safety is our number one goal.